გიორგი, ბოდიში მიკროფონი გამართული. გიორგი, აი გირეკავდი და ბარემ აქ გეტყვი, მიკროფონი გამართული.
Okay. Hey, do you hear me, guys?
Now they can hear you.
Okay. Yes. Nice. Sorry for inconvenience. That was a small technical problem, and I will try to finish. Some of students wrote me that they have another lecture, and we already missed almost 20 minutes. So let's start. Let's start directly. I guess it's recording. So let me to.
It's already recording.
Yes.
Yeah.
That's nice. So okay, let's start. And I'll also share my presentations as well. So, dear students, as you remember from the previous lecture, we are going to focus on the main points of public health issue. And last time we talked about the importance of public health and health indicators and health determinants, and how public health is big and covering all the directions. And what we are going to mention today is, I would say, and not only me, it's considered in general, it's that we're going to talk about epidemiology. And epidemiology is the key point, the most important point in public health. If you guys understand epidemiology and basic things of epidemiology, so we will understand mostly the important measures of public health, how public health works, how we do and how we investigate the things, and all the tools, and etc. etc. Let me to go share the presentation to you and start directly. So I do believe you see the presentation. Okay. Now I'm trying to looking for the whole, yeah. Yes, epidemiology. So now let's go directly and let's describe the terminology. What is epidemiology and how it works? So before we go to general understanding of epidemiology, we need to find more or less simplest understanding, find out, in order to step by step realize the things. To speak about terminology itself, the epidemiology, it's a science about the people. So epi, it's upon. Demos, we all know that it's a Greece terminology, means the people. And ology, it's also the science. The science which deals with what falls upon people, what happens with people. The epidemiology, it's also called as a bridge between biomedical, social, and behavioral science, and we will analyze later on what does it mean. So the simplest definition of epidemiology, the epidemiology is a branch of medical science which treats epidemics. So it's very, very general, but it's a science about, with this simplest explanation, it's a science about epidemics itself and pandemics. So another description is an epidemiology is a study of epidemics and their prevention. So, and above it was about treatment, yes, treat epidemics. Now we have another definition, a little bit more, with that epidemiology is a science which treat and prevent these epidemics. So, and third one, the study of the occurrence of illness. It's also very general. So, but modern definition means that the epidemiology is a study of the occurrence and distribution of health-related diseases or events in specific population, including the study of the determinants influencing such states and the application of this knowledge to control health problems. Let's just analyze now simply this definition, and then whole presentation will be followed to analyze this definition. But very simply, the epidemiology is a study of distribution of health-related diseases or events. So the epidemiology studies how any kind of diseases which related to health, communicable, non-communicable, how these diseases are distributed through the population, where this appears, which countries more tend to, let's say, diabetics, which country is more tend to infection diseases, which community and population have more problems with one or another diseases, how diseases is distributed, or event, not only diseases but event. Let's say some disaster event which also hurts and making a negative impact to the health. So this all about an epidemiology, and in specific population, what is also important. So epidemiology also very much focus on the specific type of population. So the epidemiologists study the population, people, community, special groups are related to special diseases, So to go back, it says the epidemiology is a study of the occurrence and distribution of health-related diseases or events in the specific population. So, including the study of the determinants. You remember, I do believe, from the previous lecture, which was a week ago, about the determinant of diseases, yes? Health determinants, and I'm not going to now stop again explaining that. So, influencing such states and the application of this knowledge to control the health problem. So, they use the determinants of health, the science itself, the epidemiology, to control the health problem, to prevent also diseases. So that's why epidemiology, it's a pillar, the most important thing, most important tool in public health. And who is the epidemiologist? So it's not difficult to guess that an epidemiologist is a professional who, focus on and strives to study and control the factors that influence the occurrence of diseases or health-related conditions. So it is a person who study how diseases appears, where diseases appears, and try to control those diseases through then with the population, to control the process itself, to take under the control, which is important. And we know that uncontrolled diseases is now happened or happening at the coronavirus. It's an uncontrolled. So somehow they try, the world community tries to control the process, but when the chain of contagion, spreading of diseases is spreading so wide that during the epidemiologic investigation and research, the person who has been infected by, let's say, coronavirus does not know or cannot realize or no idea how he could infect it. So it's called force contagion, contagion of force level, and it's already uncontrolled process. So, and also when epidemiologists could not investigate the contacts, how somebody could be infected in a shop or in a supermarket or somewhere else. So it's almost uncontrolled. So that's why it's very important for epidemiologists, based on their investigation tools, to control the process of even spreading of diseases, or in case of non-communicable diseases, also control the process of cardiovascular and so on, at least to have answers. Or health-related conditions, and even in specified population or society. Still, here we have a specified population or societies, because we know that specification comes from lots of different factors, like behavioral, natural, geographical, political, and what is the important thing, if you remember from previous presentations, social and economic conditions. So, and we cannot generalize whole world population into one entity. We can't do it. We cannot generalize even sometimes in a small country population, one nation like Georgia, into one entity. So, and it's people have a different lifestyle, different social and economic backgrounds, and different things. So that is important to study disease and control the process still with a specified population and societies, which has an experience in population thinking and epidemiologic methods. So experience of population thinking, it's nice to say. It's a long abbreviation. What means the experience of population thinking? So very simply say, when epidemiology can guess the behavior of population, the cultural things of population, or focus group. Epidemiologic method, we will see later. It's a special research and investigation methods of scientific methods of collecting data and analyzing data, and it's called epidemiology. They use a special tool as an epidemiologic method to investigate the process, to find the course, and it's knowledgeable about public health and causal inference in health. So this is a person of epidemiologist who has a lot of things to do, and it's not only related with infection and communicable diseases, but also all the areas covering by public health, even non-communicable diseases. So, and epidemiologists are required to have some knowledge of, which does it mean epidemiology covered this following direction of scientific direction, like public health, which is obvious because of the emphasis on disease prevention. It's very important, and the control process and investigation. Clinical medicine, so treatment. because of the emphasis of disease classification and diagnosis. That's very important. So epidemiologists during an investigation, they need to classify diseases in a specific society. They need to find the specific diagnosis during spreading of diseases, especially infection diseases. So they need, of course, the clinical medicine knowledge. So with the public health, the pathophysiology. You are guys the second semester, if I remember correctly. So maybe you don't know exactly the terminology, and you will learn it later on during your life science and body system subjects. But shortly to say here, because of the need to understand basic biological mechanisms of diseases, how disease act itself. So when we say, when we start discussion about corona, when world society and especially start discussion about the corona, what they say, we need to find the pathophysiologic genome of that virus. So how the virus act, how the virus behavior, how it spread, how it acts in a human, and different things. We don't know 100%, we don't have 100% proven yet, but the pathophysiology knowledge in pathophysiology, but the basic knowledge at least, the epidemiologists need, because to understand basic biological mechanism of diseases, the mechanism. So biostatistics, that is very important. The statistic, it's one of the important tools for epidemiologists to collect data and do the investigation and research. And because to need to qualify disease frequency and its relationship to antecedents. So simply say, the biostatistic, knowledge of biostatistics, the epidemiologist needs to do a correct, proper investigation of spreading of diseases, or also to do a special cross-check research with population, with special groups of people, and with special clinical classification of disease, comparing the classification of diseases. So, and why we have shown this, what knowledge epidemiologists need, is because the epidemiology itself, as a science, as a direction, as a pillar for public health, is covering those important direction of medical world. So public health, clinical medicine, pathophysiology, and biostatistic. So it's very important to know. Also, social science. The social science, it's about the behavior, because of need to understand the social context in which diseases occurs and presents. So special group of people, their behavior, their acts, their social needs, their religion specification, their cultural diversity, and so on. So 1, 2, 3, 4, 5 basic covering directions for epidemiologists. What is the purpose of epidemiology? So we talked about that, but we can repeat to come up. The purpose of epidemiology is to investigate the nature, extent of health-related phenomena in the community and identify priorities. So I think it's clear. And also to study natural history and prognosis of health-related problem, how this appears, this or one or another diseases, or that these diseases has early history. When we start talking about corona, what was first known is that coronaviruses exist from, or founded from, at least early 2000s. It is not absolutely new infection diseases. This is a different type of diseases, which is why it's called new or newest COVID-19, because it's a part of the family of coronaviruses. But when they start the deciphering of genomes, of course, there are lots of service in scientific research. And in January, when the Chinese scientists tried to make a decipheration of the genomes, lots of service did, because they knew early the special specification of coronavirus family, which is known by SARS, MERS, and so on, from 2003. So, and that because it can be emerge and re-emerge infection diseases, which we'll know later on. That's why it's very important, the history of diseases, and thus make a prognosis how it can appear. So to find a common logic, and to identify cause and risk factors. Of course, it's obvious and clear. To recommend, assist in application of what best in the interventions. What is an intervention? What the specialist can do, rapidly act. So and provide foundation of public policy, and then a creation of special policy against any diseases. So we don't need, let's keep here. And now it's very important to know the terminologies in epidemiology. So this is two important terminology. One, the descriptive epidemiology, and another analytical epidemiology. So let's find out what does it mean. The descriptive epidemiology, it's examining the distribution of a disease in population. So the descriptive epidemiology, very simply say, describes, shows distribution of disease in population. How this disease appears, or not how, where this disease exists, how many people is infected, which kind of population is impacted, the gender, the different data, age, any other specificities. So descriptive epidemiology just shows you the picture, describe the process. So in a population, and also the observing, the description of epidemiology, it's mostly have an observational character. You just look and you note the data, you see what is happening, and you just taking the data. That is the description epidemiology. And you also make a monitoring, the observation, the basic features of that distributions, what the specification that distribution have, not only in case of infection diseases, but also non-infection, non-communicable diseases. So the obesity, let's say, and diabetes in the United States, and other things in different countries. And what is important is that distribution should be recorded based on time, place, and person. So the descriptive epidemiology needs to know three most important things. Time, when it's happened or happening, place, where it's happening, and a person, to whom it's happening, to whom is infected or making under the impact. So you make a description of these three most important things, the numbers or any other details. And typical study design is a community health survey, yes, no, special community. Now, analytical epidemiology, what's the difference? The analytical epidemiology is making, they are testing a specific hypothesis about the relationship of a diseases to a specific cause by conducting an epidemiologic study. So what does it mean? So when you collect the data based on descriptive epidemiology, what do you need? Very simple thing. Then what do you need to do with this data? You need to analyze this data. You need to analyze this data and to find the solution or find the answer or find the answer on the most important questions. And here is very important is to find the relationship of diseases and a specific population, or diseases and specific behavior of the people, you know. So the analytical epidemiology to analyze and find the special relationship of diseases and cause of these diseases, not only population, but also cause, how this disease appears. I see the sum of the diseases with that and that mostly spread. I see it based on descriptive epidemiology. When I analyze time when it's happened, when I analyze place where it's happened, and analyze people with whom it happened, and in people I analyze the age, I analyze the gender, I analyze the other diseases or any other things. So I realize that I collect data, and during the analytical epidemiology, I found the connection between the age and between the for example, let's say behavior, or between the place, the mountain people arises things because of that. I will provide the examples later a little bit. So the relationship of diseases to a specific cause by conducting an epidemiologic study. So during the analytical epidemiology, they use a special epidemiologic study design that relates exposure of interest to the outcomes of interest. What does it mean? That's that simple. So finally, where we go and what will be an outcome of my analytic. So I need to find these two things relationship. So, and typical study design, how the analytical epidemiology it's conducted. It's a cohort, please remember, case control and experimental design. They use cohort tool, case control tool, and experimental tool to make an analytical thing to analyze this collective data. In terms of descriptive epidemiologies, they use only community health survey. They go through the population and take a survey and ask the questions around. And so mostly in a descriptive, they are using the method of survey, community health survey, health status, and so on and so on, and they collect data. But in analytical epidemiology, they use the method of cohort, case control, and experimental design. So later we will see what does it mean. So to undertake an analytics epidemiologic study, you must first know where to look, of course, what to control for, and be able to formulate hypothesis. Yes, hypothesis, it's like a different diagnosis. It's the same with epidemiology. When you try to find a diagnosis with your patient, you cannot find the exact diagnosis in a first attempt. You do a suspect with diagnose in clinical treatment, I mean. And then you do a different diagnosis, several versions, hypothesis of diagnosis, and then you find the one. So the same is happening with epidemiology study. of the process of they generate a hypothesis. So now I'm just asking you, what would be three important things of descriptive epidemiology? Three important things. Remember here? Three important things of descriptive epidemiology. Person, place, time. So that's the same. What the personal characteristic, what under the person we mean, or which kind of data they collect. So age, gender, social economic status, education, occupation, marital status, ethnicity, genetic, behavior, habits, smoker, drinker, or healthy lifestyle. So which kind of data we collect with the relationship with place? So geographically restricted or which kind of area? So outbreak, epidemic, pandemic, offshore, or maybe climate effects. So urban, suburban, or rural, or it's very crowded place, or megapolis. So relation to environment exposure, if something happens, water, food supply, and so on. Time. So changing or stable. What does it mean? It means that the process, the sequence of the process is stable or it's changing a lot. So clustered, it's epidemic or distributed. Endemic, we will see these terminologies. That's why I'm not going deeper. And time trend, point, source, and so on. Which kind of designs during the descriptive epidemiology they use? If you remember, which kind of tool, which kind of what method they use to investigate? Mostly qualitative designs and quantitative designs. So what does it mean? The quantitative design, when you collect data based on surveys and questionnaires. The qualitative designs, when you collect data with a deep interview with patient and with people. So and the qualitative also divides with observational and experimental direction tool of investigation. So and building evidence. What measures the epidemiologists use? The frequency measures, effect measures, and impact fractions. We'll see it later. Measuring design frequency in population. What the frequency means. Classifying and categorizing diseases. Different classification of different diseases. I think it's clear. So then, deciding what constitutes a case of diseases in a study. So the relationship of diseases. And finding a source for extracting the cases. Yes, let's just simply say it's a source of diseases. And defining the population and risks of diseases. Yes, some people are under the high risk with some different diseases. Mostly it's children and mothers and so on. And they need to define which kind of population are under the first risk. Let's say in COVID-19, the elderly people are the over 65 and 70 years old are under the direct risks of that COVID-19. And the objective for epidemiologists worldwide and specialists is to avoid the elderly people to not be infected by coronavirus. It's defining the population at risk. So defining the period of time at risk diseases, which is winter in or early spring in case of corona pandemic, and obtaining permissions to study people, of course. So they need to, this is an ethical issue when you do investigation. So to have a permission to do a study and making measurements of diseases frequency, which already we talked about. This basic triangle of analytical epidemiology, what it would be in case of analytical. You remember? So it's a host, it's agent, and environment. So what does it mean? Let's describe, analyze. The host, let's say in corona, how the coronavirus is spreading. The coronavirus needs host. The virus itself cannot walk in a street and reach one or another place independently. The virus need host. The host in this virus was early the different animals in Chinese Wuhan market, and then host became a human being, the people. The host is in case of infection diseases, of course, it's a thing where this virus goes and then multiply. So what is an agent? Agent, it's virus itself, the pathogen itself. An environment is a place where this contagion happen, or maybe in some cases, if it's cold and the respiratory illness are spreading faster, stronger. If it's very warm, it's become the less frequency. So we all have an expectation that it's summer. In the summer, the virus and this respiratory spreading chain will be a little bit become reduced and become a passive. So this is just because environment is a special place, and also we need we know from scientists in COVID-19 that about the COVID-19 that in sunshine, under the strong sun, the virus is deactivated. So and in analytical epidemiology, they need to analyze the three things also together with another things: the host, agent, and environment. So, and about an agent, it's a biological, microorganisms, and physical. We talked about the chemical environment. A host is the genetic environment, immunological, personal characteristics, personal behaviors. When we do not wash our hand and we became accidentally hosts and do not take a distance or any other preventing behaviors and actions. So we became hosts. And environment, as I told you, living condition, atmosphere, climate, and so on. Does epidemiology assist in problem solving in health-related policy making? Of course it do. So this is not something very important thing. The first is more about the political epidemiology and information science. The second, yeah, we talked about that. Nothing important. That information science, purposive public security, and so on. Oh yes. Now to focus here. What do you see? So you see the steps of the solving the health problems. So to see in one picture, step one, we need to collect data, descriptive epidemiology. Step two, and the data collection is a surveillance, determine time, place, and person. Step two, assessment. Inference, it's kind of analytical. Steps three, hypothesis and testing, generating the different hypotheses and ideas. It's also analytical, determine how and why. And step two, when we find the source and problems, then we act. We act based on analytical data, what we analyze. So here we have a small, test for you, just to understand the things. Let's see the test. Questions. All of the following illustrate the purpose of epidemiology in public health except. So it would be our, meeting face to face. When I do this meeting, I'm always asking to audience, what is your answer? Now you can write in your ideas. So all of the following illustrates what is the purpose of epidemiology in public health except something. One of those possible answers is not correct. So identifying population who are at risk for certain diseases. So let me to go. Oh my God, I did mistake. But I wanted to see your answer. Okay, no problem. Just discuss about it. So now we can see the identifying of population who are at risk for certain diseases. Of course, it's purpose of epidemiology. Assessing the effectiveness of interventions. Of course, how effective these regulations or recommendations or limitations, any kind of intervention, treatment, or even some IDPs process, it should be assessed. And providing treatment for patient in clinical setting. So this is not a purpose of epidemiology. Providing treatment for patient in clinical settings, it's a thing of clinical treatment, not epidemiology. Determining the importance of cause of illness, it's also a purpose of epidemiology. Another question. Epidemiologists, as you see, use a model of studying infection diseases and its spread that involve the microbe that cause the disease, the organism that harbors the disease, and the external factors that cause or allow disease transmission. This is also known as, just realize, okay, follow to me. Epidemiologists use a model for studying infection diseases. We're talking about the infections. And its spreading process that involves the microbe that cause the diseases, the organisms that harbor the diseases, and the external factors that cause or allow disease transmission. What is it? Host, vector, and transmission? Host, vector, and transmission, its process. Transmission, host, and environment. Just think about it. The process is a transmission, host then, and environment then. So host, agent, and environment, or organism, transmission, and environment. Of course, host, agent, and environment we remember from several slides above. It's golden standards of analytical epidemiology, also processing. It's a host first, the human being, then agent, disease itself, and environment where it's happened. Why host, vector, and transmission is not correct? Because transmission, it's a process. The vector, it's a direction of this process, which nothing to do here. So transmission, host, and environment is not correct because the process is not happening first. So, and organism, transmission, and environment, it's absolutely not correct. So Now about the epidemiology key terminology. You guys are hearing every day in your news coronavirus pandemic, coronavirus epidemic, cluster, rate. What is the difference? What those things means? So epidemic or outbreak. The epidemic or outbreak, guys, it is happening when it's happening, the sequences, the lots of cases in one country. So disease occurrence among a population, the specific population that is in excess of what is expected in a given time and place. So let's say difference between endemic, no, pandemic and endemic, pandemic and epidemic, but we don't have a, yes, pandemic or epidemic. So worldwide, the coronavirus is a pandemic disease. So the common and biggest problem for all kind of society and the countries. But in Georgia, if we have lots of coronavirus cases for Georgian population, for specific place, in specific place, with specific people, in specific time, it's an epidemic or outbreak, okay? But pandemic, it becomes, so let's say in some time in India, the malaria was epidemic or outbreak because it was a problem of India in those time of period when they had lots of malaria cases. It was epidemic. Only, let's say, for India or for special geographical region in special time with special people having its own reasons why it's happening and appearing here. But in pandemic infection diseases becomes when it's become a problem for very different from and very diverse society, absolutely different from geographical and environmental basics for all types of people. It becomes pandemic. So because when the director of World Health Organization mentioned about or mentioning about coronavirus worldwide, he says pandemic. But when head of, let's say, Anthony Fauci talks about the corona cases in the United States, he's saying if he's mentioning the United States Society of People or one of the other state, so or New York State or something, he mentions about an epidemic or outbreak. So what cluster means? You also, I do remember, I'm pretty sure you also hear a lot of time that this cluster, the new cluster has been created in Corona, and so on and so on. The clusters are simply the group of cases or people with a specific time and place that might be more than expected, so or infected. Special group, it's a cluster. So now about an endemic, what endemic means: disease or condition present among a population at all times. Okay, let's say the COVID-19 is a little bit new, but it's still the part of the coronavirus family. Where the coronavirus appears first time in 2009, 2003 or something, or maybe earlier, in the West. Okay, let's. The corona is not the best example because it doesn't have a very long history of development, or we don't know that. But let's say even the malaria, even the Black Plague, even the any other old historical infection diseases. So the endemic infection disease becomes when the disease in special population has a long history of existence, and it comes back several times in a frequency. So pandemic, we already mentioned, spread across the regions. The diseases which spread across the regions, and the rate in terms of epidemiology is the number of cases occurring during a specific period allows depend of the size of the population during that period. It's a rate, special rate. When we say the rate of that corona is here, is that and that, it's a special number of cases occurring during this specific period, the short time of period. Rate today, rate last night, rate of death, rate of new cases. It's a specific period. So always depend on the size of the population, and on the during that period. So that's a simple, I think. So these 1, 2, 3, 4, 5 very basic and very important terminology in terms in epidemiology, key terminology. So let's check our knowledge. We have 3 choices: endemic, pandemic, epidemic. So first, malaria is present in Africa at all times because of the presence of infected mosquitoes. Malaria is what? Endemic in Africa, pandemic in Africa, or epidemic in Africa? Of course, it's endemic because it's we have mentioned all time. If you remember, endemic is disaster condition present among the population at all times, which was always happening and coming sometimes back. So the Ebola virus in parts of Africa is in excess of what is expected for this region. The special expected or characterized for this special Central Africa region. Ebola does not spread in all over the world, but was very common and killer in the, let's say, Congo or somewhere. So what is Ebola? The virus is of course, it could be an epidemic. Yes. And HIV, AIDS, or coronavirus is one of the worst global disease in modern history. It is a pandemic because it's in all over the world. So now the small test about distribution, cluster, and determinants. So in March 1928, an outbreak of measles occurred among employees at Factory X in Fort Worth, Texas. This group of cases in specific time and place can be described as this group of cases in this specific time and place. Just remember, specific time and place can be described as a cluster, if you remember here. Yes, cluster, second one. Yeah, calculating rates. So very simply, I will say here, and then we finish. that the how rate is calculated. This rate, guys, this one, last one, number of cases, which is always depend the size of population. So the rate is calculated like that. The rate percentage, it equals number of new cases, number of coronavirus cases, divide in the population at risk, and then multiply with 100. So this is a rate. To calculate a rate, we first need to determine the frequency of diseases, which includes the number of cases of illness or conditions, of course, the new cases or cases, the size of the population at risk, how many people lived in this area or something, or maybe special risk groups, and the period during which we are calculating the rate. So this is just simple examples, which is not common for today. One day, one of technology conferences, San Diego 50% tool. Yes, this is a little bit difficult test. You can work on yourself when you find the presentation. Epidemiology approach and methods. So here we have epidemiology approach and methods. Epidemiology study types, experimental and observational. This last terminology which you should remember. The observational, we remember, it's a descriptive and analytics. Observational and experimental, the descriptive epidemiology. The observational epidemiology means a descriptive. We describe, we see, we collect data, and then analyze this data. It's all about an observational. So descriptive epidemiology, when was the population affected? Where was the population affected? Who was affected? Analytic epidemiology, how was the population affected? Why was the population affected? What's happened? So, and why? This is analytical. So choose the correct answer from the following choices: qualitative, experimental, observational. Okay, let's do this test. An epidemiologist is doing a study on the sleep patterns of college students, but does not provide any intervention. No intervention, just study. What type of study is? Observational. They collect data, they do the study. So descriptive of analytic, a study of health diseases comparing a group who eats healthy food and exercise regularly with one who does not, in an effort to test association. Okay, guys, just I understand that you are tired, me too, but just pay attention on it because it will come to your the exams, the midterms, and the finals as well. So what does it mean? This means that to find a connection, between the process happening and the disease itself. Let's say here, and then I'll provide another example. A study of heart diseases, heart attack or different heart diseases, they compare heart diseases, they collect data of heart diseases, and they compare a group who eats healthy food. So people who does not do it, eats a lot of mayonnaise or unhealthy food or lots of, lots of fat and so on, or heart diseases comparing with healthy lifestyle or healthy food and exercises regularly. Yes, healthy food and exercises regularly, healthy lifetime, with one who does not, in an effort to test association. So this is collective. This is analytical. Yes. So, or in let's say another case, smokers and lung cancer. They found to find a relationship of a smoking as a behavior in one type of population or special groups, and then find out and collect the lung cancer cases. If you compare these two data, you find out scientifically, based on research, that in terms of smokers, the cases of lung cancers are 2-3 times higher, rather than the process, the facts, the collective descriptives of non-smokers. So, and then you can just make a hypothesis that smoking can cause a lung cancer. Very simply say. A study to describes another one. Second describes the eating habits of adolescents aged 19, 30 years in community X. It's a descriptive. Yeah, that's very simple. What we have study design, so intoxicated electronic, it's another cross-sectional cohort case control. Oh, okay. What does it mean? Subject with this diabetes are compared with subject without diabetes. Okay, let's say subjects with diabetes are compared with subject without diabetes. Case control. Case and the control. Two types compare. A study of women aged 50, 60 years in a community located close to a nuclear power facility. It's a cross-sectional. A subject who have received nutritional counseling and who have exercised twice a week are compared with subjects who have not do it. It will be a cohort. So when I provide an example, the comparing the smokers and lung cancers, I think it's a cohort study. And just please be focused on it very much. So investigating on outbreak. We don't need that to focus on. Another knowledge test about outbreak. Yeah. The most important terminologist we provide. And now let's go back to your questions. Do you have any question? Just please. Oh, 49 question. Oh my God. Can you give us more information on midterm? Oh my God. Just go in your syllabus. What topics to focus on with the question? I think you are new because in my 2 previous lecture, I was talking only about this midterm, dear student. I think you just need to go find out the syllabus on your drive, and then you will see the midterm here, and all about topics above the midterm will be included in the first midterm. So let's see another. What's the portion for mid one? Still the midterms. Socioeconomic 40/40, genetics 20/20. The connection is when time, place, person. Careful. So it's only the comments. The questions on the test, in some questions are similar, but some questions is not. How long is the midterm? The 30 question, 1 hour, I think. Okay, guys. Thank you for your attention, and see you in next week.